NLN Next Test Questions. Question 1. Which probability describes drawing a red card from a set with 5 red and 6 blue cards in this patient chart item? Option A, 5/11ths. Option B, 6/11ths. Option C, 11/5ths. Option D, 5/6ths. The correct answer is option. Probability is favorable outcomes divided by total outcomes, so the result is 5/11ths, simplified to 5/11ths. The other choices use blue cards, compare red to blue only, or invert the fraction. Question 2. During a quick NEX review of a lab result item, which word is closest in meaning to analyze in a nursing entrance reading item? Option A, decorate. Option B, float. Option C, forget. Option D, examine. The correct answer is option. Analyze means examine, so that choice matches the meaning in context. Decorate means make attractive, not examine. Float means rest on a surface, not examine. And forget means fail to remember, not examine. Question 3. After checking the choices in a health literacy item, which answer identifies the substance dissolved in a solution? Option A, precipitate. Option B, solvent. Option C, catalyst. Option D, solute. The correct answer is option. The solute is the material being dissolved. Precipitate is a solid that forms in solution, solvent does the dissolving, and catalyst speeds a reaction. Question 4. If a safety protocol stem gives one clear clue, which inference is best supported by the passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A, training increased infection rates. Option B, the refresher removed all risk permanently. Option C, hand hygiene cannot affect infection. Option D, training may have improved compliance with hygiene practices. The correct answer is option. The sequence suggests training supported better hygiene behavior. Training increased infection rates is not supported by the passage. The refresher removed all risk permanently is not supported by the passage, and hand hygiene cannot affect infection is not supported by the passage. Question 5. When time is limited on a concept map question, which increase is shown from Monday 13 to Wednesday 23 in a simple practice chart? Option A, 10. Option B, 36. Option C, 23. Option D, 7. The correct answer is option. The increase is the final value minus the starting value, 23/13 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 6. Given the information in a hydration log item, which milliliter amount equals 2.4 L? Option A, 240 ml. Option B, 24,000 ml. Option C, 24 ml. Option D, 2,400 ml. The correct answer is option. 1 liter equals 1,000 ml, so 2.4 times 1,000 equals 2,400 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 7. Suppose a similar vital signs item appears on test day. Which word is closest in meaning to brief in a nursing entrance reading item? Option A, complex. Option B, bitter. Option C, short. Option D, lengthy. The correct answer is option. Brief means short, so that choice matches the meaning in context. Complex means complicated, not short. Bitter relates to taste, not length, and lengthy means long, not short. Question 8. While working through a timed cell energy set, which answer identifies the transfer of heat through direct contact? Option A, conduction. Option B, evaporation. Option C, convection. Option D, radiation. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Evaporation is liquid changing to gas, convection moves heat through fluid circulation, and radiation transfers energy by waves. Question 9. Before choosing an answer in a patient teaching item, which inference is best supported by the passage? A clinic sends appointment reminders, and missed visits decline. Option A, appointments no longer need scheduling. Option B, patients cannot benefit from reminders. Option C, reminders can help patients remember appointments. Option D, reminders caused more missed visits. The correct answer is option. The decline in missed visits supports the role of reminders. Appointments no longer need scheduling is not supported by the passage. Patients cannot benefit from reminders is not supported by the passage, and reminders caused more missed visits is not supported by the passage. Question 10. A student sees this dosage label idea on a NEX review. Which answer identifies the transfer of heat through direct contact? Option A, convection. Option B, conduction. Option C, evaporation. Option D, radiation. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Convection moves heat through fluid circulation. Evaporation is liquid changing to gas, and radiation transfers energy by waves. Question 11. One infection control practice problem tests this skill. Which sum equals 1/2 plus 3/8? Option A, 7/8. Option B, 1/8. Option C, 3/2. Option D, 7/16. The correct answer is option. The denominators are already the same, so add the numerators. For plus 3 equals 7, then simplify to 7/8. The other choices subtract the numerators, multiply parts of the fractions, or change the denominator unnecessarily. Question 12. Several choices look tempting in a fall prevention item. Which word is closest in meaning to concise in a nursing entrance reading item? Option A, wordy. Option B, timid. Option C, brief. Option D, damp. The correct answer is option. Concise means brief, so that choice matches the meaning in context. Wordy means using too many words, not brief. Timid means shy, not brief, and damp means slightly wet, not brief. Question 13. For this nutrition note nursing entrance question, which answer identifies the repeating a study to see if results hold? Option A, classification. Option B, replication. Option C, bias. Option D, estimation. The correct answer is option. Replication checks whether results are reliable across repeated trials. Classification is grouping items, bias is a systematic error, and estimation is an approximate calculation. Question 14. In a short oxygen exchange practice STEM, which inference is best supported by the passage? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A, comfort never changes with practice. Option B, timed sets remove all content gaps. Option C, timed practice can build exam familiarity. Option D, the exam has no time pressure. The correct answer is option. The passage connects timed practice with increased comfort. Comfort never changes with practice is not supported by the passage. Timed sets remove all content gaps is not supported by the passage, and the exam has no time pressure is not supported by the passage. Question 15. Among the choices in a study schedule item, which critical thinking response best fits this situation? A test item asks for the best answer, and two choices are true but only one directly answers the STEM. Option A. Any true statement is always best. Option B. The choice that directly answers the STEM should be selected. Option C. The longest answer is automatically best. Option D. The first familiar term should be chosen. The correct answer is option. Entrance exam items often include true distractors that do not answer the specific question. Any true statement is always best does not follow from the situation. The longest answer is automatically best does not follow from the situation, and the first familiar term should be chosen does not follow from the situation. Question 16. Using the facts in a lab safety question, which dose volume gives 37.5 mg from a supply of 75 mg per 5 ml? Option A, 0.5 ml. Option B, 5 ml. Option C, 1.25 ml. Option D, 2.5 ml. The correct answer is option. Set up the proportion 75 mg, 5 ml equals 37.5 mg x ml, so x equals 37.5 times 5, divided by 75 equals 2.5 ml. The other volumes reflect errors such as doubling the dose, having the dose, or reversing the proportion. Question 17. Based on the clue in a blood flow item, which word is closest in meaning to demonstrate in a nursing entrance reading item? Option A, guess. Option B, hide. Option C, delay. Option D, show. The correct answer is option. Demonstrate means show, so that choice matches the meaning in context. Guess means estimate, not show. Hide means conceal, not show. And delay means postpone, not show. Question 18. Consider this high-yield kidney function concept. Which answer identifies the tiny vessel where nutrient and gas exchange occurs? Option A, vein. Option B, trachea. Option C, capillary. Option D, artery. The correct answer is option. Capillaries have thin walls that allow exchange with tissues. Vein returns blood to the heart, trachea carries air, and artery moves blood away from the heart. Question 19. Near the end of an immune response review session, which answer best explains the author's point? A patient education sheet used short sentences, headings, and pictures. Option A, long paragraphs are best for patient teaching. Option B, clear formatting helps readers understand health information. Option C, pictures make written instructions unnecessary. Option D, headings reduce the value of information. The correct answer is option. The sheet is designed to improve readability and comprehension. Long paragraphs are best for patient teaching, is not supported by the passage. Pictures make written instructions unnecessary, is not supported by the passage. And headings reduce the value of information, is not supported by the passage. Question 20. Across similar medication math nursing entrance questions, which increase is shown from Monday 12 to Wednesday 20 in a simple practice chart? Option A, 20. Option B, 32. Option C, 5. Option D, 8. The correct answer is option. The increase is the final value minus the starting value, 2012 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 21. Since only one choice fits the reading passage clue, which average results from scores of 65, 69, and 73? Option A, 207. Option B, 67. Option C, 8. Option D, 69. The correct answer is option. Add the 3 scores to get 207, then divide by 3 to get 69. The other choices use the sum, the range, only 2 scores, or an added value rather than the mean. Question 22. From the information in a grammar check item, which word is closest in meaning to emphasize in a nursing entrance reading item? Option A, divide. Option B, minimize. Option C, stress. Option D, borrow. The correct answer is option. Emphasize means stress, so that choice matches the meaning in context. Divide means split, not stress. Minimize means make less important, not stress. And borrow means take temporarily, not stress. Question 23. At a testing desk during a word knowledge review, which answer identifies the organ that produces bile? Option A, gallbladder. Option B, pancreas. Option C, kidney. Option D, liver. The correct answer is option. The liver produces bile, which helps digest fats. Gallbladder stores bile, pancreas secretes enzymes and hormones, and kidney filters blood. Question 24. Inside a data table science or skills item, which answer best explains the author's point? A volunteer program grew after former patients shared personal stories at orientation. Option A, orientation should never include stories. Option B, volunteer programs grow without communication. Option C, former patients stopped the program. Option D, personal stories can motivate people to participate. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Orientation should never include stories, is not supported by the passage. Volunteer programs grow without communication, is not supported by the passage, and former patients stopped the program, is not supported by the passage. Question 25. Through careful reading of a algebra review STEM, which answer identifies the group that does not receive the experimental treatment? Option A, sample. Option B, conclusion. Option C, control group. Option D, experimental group. The correct answer is option. A control group provides a comparison for the treatment group. Sample is the participants or items studied, conclusion is the final interpretation, and experimental group receives the treatment.